Today we're going to be focusing on women's health and we're going to be talking about uterine fibroids, also called leiomyomas. Now, this is a highly prevalent condition and it is said 20 to 80% of women will develop fibroids by age 50. Hi, I'm Dr. Francisca Osage and thank you for joining me on Francisca on Health Matters. So, what are uterine fibroids? These are benign tumors of the uterus. Now, you might have the tendency to get alarmed when you hear the word tumor. Remember, tumors can fall into one of two categories. There's the cancerous tumor, which is a cancer. There's a non-cancerous tumor, which is a benign tumor. So fibroid is a benign tumor of the uterus. Now, a further description of a fibroid could be based on its location relative to the uterus. Those that are found or formed on the lining of the inner part of the uterus are called submucosal fibroids. Those that are found or formed within the muscle itself are called intramural fibroids. And those that are formed on the outer lining are called subserosal fibroids. Now, for the category of subserosal fibroids, some might develop a stem-like projection on which they attach to the outer covering or the outer part of the uterus, and these are described as pedunculated fibroids. Now, what causes fibroids? There is no known cause for fibroids. However, there are risk factors that are known to predispose to fibroids. And what are these risk factors? There is the genetic predisposition and hence the significance of a positive family history. There is the racial predisposition. It is known that black women, among other races, are easily prone to developing fibroids. There is the impact on a high body mass index, the early onset of menses, that is menarche, and a late onset of menopause are also risk factors that could predispose one to developing fibroids. Now, the next question you might ask is, Doctor, how do I know I have a fibroid? Now, although it is a highly prevalent condition, in the US it is said that 70% of white women and 80% of black women will develop fibroids by age 50. Most times it is asymptomatic and it is found incidentally, that is, during the investigation for other causes. But when symptoms present, the symptoms range depending on the size of the fibroid, the number of the fibroids, the location of the fibroids. For instance, when it is located in the front of the uterus, which is typically behind the urinary bladder, there could be presentations such as frequency in urination. There could be recurrences of UTI infection, urinary tract infection. If it's posteriorly located, that is at the back of the uterus, which happens to be in front of the rectum, there could be presentations such as constipation. However, most times, what typically makes a woman present to her OBGYN are the abnormal changes in her menstrual flow, because this could be very discomforting. It could cause her to call out of work and miss out on social engagements or family engagements. And what are these menstrual flow abnormalities? There could be prolonged bleeding, and then there's the heavy menstrual bleeding. Now, you would know the typical amount of pads or tampons used in a day. You find out that you're using way more during the presence or in the presence of a uterine fibroid. There's also the intermenstrual bleeding that could occur in the presence of a fibroid, and painful menstrual cramps also occur. Now, there are other symptoms that could be present, such as bloating, back pain. There could be constipation, like I said, urinary frequency. There could be difficulty passing urine. When these symptoms appear, then there's a tendency to present to the OBGYN. Now, should you experience these symptoms and present to an OBGYN, there will be the need to confirm this is a case of a uterine fibroid and exclude other possible causes that could present with symptoms similar to that of a fibroid. And so there will be the need to take an extensive history. You then get examined, and there might be the observation of a distended pelvis or abdomen, which feels firm when felt. A pelvic ultrasound is then used to confirm the presence of a uterine fibroid. The ultrasound will reveal the location of the fibroid, the presence of a single or multiple fibroids, and also the size of the uterine fibroid. Now, if there are no symptoms and you're soon approaching menopause or within the season of menopause, that might be the advice of doing nothing, that is, watchful waiting, with the hopes that with menopause there will be decreased estrogen, which typically feeds the fibroid, and with a decrease in estrogen, the fibroids eventually shrink. On the other hand, active management will include the use of medications that will control symptoms of excessive bleeding and menstrual pain. And such medications include Lysteda, also called tranexamic acid. You have GnRH analogs. There's the use of NSAIDs such as ibuprofen or naproxen. There's the use of contraceptives, and these help in controlling symptoms of excessive bleeding and menstrual pain. Taking supplements of iron, vitamin B12, and folic acid might also be necessary due to symptoms of fatigue arising from anemia as a result of excessive menstrual bleeding. Now, there are also interventions or procedures that could help to control symptoms, and this will include the uterine fibroid embolization. There's also ablation procedures, which use of high intensity ultrasound waves. There's the myomectomy, in which the fibroids are taken out. There's the hysterectomy, in which the uterus, together with the fibroids, are taken out. Previously, the management options for uterine fibroids were very restricted to the surgical approach via hysterectomy. However, in current times, there are more interventions or procedures that could be made available, hence the need to have that discussion with your OBGYN on what suits you best. Now, what is the take home for this talk? Fibroid is a highly prevalent condition, and there is no need to hide or be ashamed should you present with symptoms suggestive of fibroids. Do have that discussion with your primary care or OBGYN and see what options best suits you in the management of a possible fibroid. Again, I hope you found this informative and educative, and if you have, please subscribe, and I'll see you in the next one.